The muscular system is made up of over 600 muscles. While we won't be recovering all 600 individual muscles in the overview with you, we will be discussing the main function of the muscular system, the 5 major properties, the 5 types of muscle movement, 3 types of muscles, and how all of these work together to make up we know as the muscular system. The primary purpose for the muscular system is to provide movement for the body. Now, this muscle receive the ability to move through the nervous system. There are 5 major properties to the muscular system. 1. Excitable or irritable. This means that they are capable of receiving stimulation and responding to stimulation from the nerves. 2. Contractible. After receiving stimulation, they are capable of contracting or shortening. 3. Being extensible means a muscle can be stretched without damage by the application of force. 4. Elasticity. A muscle is able to return to its original resting shape and length after being extended or contracted. 5. The muscular system is adaptable in that it can be changed in response to how it is used. For example, a muscle will enlarge or undergo hypertrophy with increased work. But in the other hand, it can go into atrophy or waste away if deprived of work. Now, let's look at the 5 types of muscle movement. 1. Adduction. Adduction is the moving of a body part towards the midline of the body. 2. Abduction is moving a body part away from the body. Number 3. Flexion means bending a joint to decrease the angle between 2 bones or 2 body parts. 4. Extension, straightening and extending of the joint to increase the angle between 2 bones or body parts. And lastly, rotation. Rotation involves moving a body part around an axis. The muscular system is divided into 3 main types of muscles, and each of these types can be moved by one of 2 ways, either voluntary or involuntary. The cardiac muscle is an involuntary muscle, meaning it operates without any conscious control. These muscles form the walls of the heart and contract to circulate the blood. The visceral or smooth muscles are also considered involuntary. These muscles are found in organ or organ systems such as digestive or respiratory system. And the 3rd type of muscle is the skeletal muscle. These are what we typically think of when talking about muscle. These muscles attach to the skeleton and provide the skeleton with the ability to move. The skeletal muscles are classified as voluntary. This is because we have to make as a conscious effort or decision to make them move. Although muscles obviously make up the muscle system, there are still some supportive structures that we need to look at what are also necessary part of the system. Tendons and fascia are important supportive structures for the skeletal muscles. Simply put, tendons are what attach a muscle to above and fascia connects muscles to other muscles. Tendons and fascia work together with muscles, which create the muscular system necessary for movement. The only organ is not directly dependent upon the nervous system is the cardiac or heart muscles. Let's proceed to diseases and symptoms. What is dermatomyositis? Dermatomyositis is a chronic inflammatory disease affecting muscle tissues. What are the causes of dermatomyositis? Dermatomyositis is seen as an autoimmune disorder where the body damages its own tissues. What are the signs and symptoms of dermatomyositis? The primary sign of dermatomyositis is a muscle and joint pain. Another noticeable sign is the manifestation of rashes on your skin. The rashes discolor your skin and make it feel scaly, dry, and sunburned. The rashes occur in various areas such as knees, knuckles, shoulder, and back. Other signs include weight loss, mild fever, inflamed lungs, and light sensitivity. What are the complications of dermatomyositis? Complications of include difficulty in swallowing, calcium deposits, and pneumonia. What are the associated conditions that might be caused by dermatomyositis? Dermatomyositis might put you at a higher risk of developing infections. Some of the typical infections are liver and cardiovascular disease and cancer. How is dermatomyositis diagnosed? Dermatomyositis is diagnosed through medical procedures. Common procedures such as X-rays, blood tests, and electromyography. Is dermatomyositis treatable? Well, no. Only symptoms of the disease can be managed. Symptom management, treat rashes and administering anti-inflammatory drugs. Other treatment includes heart therapy, orthotics, exercises, and rest. So let's proceed. Polymyositis disease. So what is polymyositis? Polymyositis is one of the inflammatory myopathies, a group of muscle diseases that involves inflammation of the muscles or associated tissues, such as blood vessels that supply the muscle. A myopathy is a muscle disease, and inflammation is response to cell damage. Another word for inflammatory myopathy is myositis. The mu root means muscles, and the itis root means inflammation. So a myositis is an inflammation of muscle disease. What are the signs and symptoms of polymyositis or PM? Polymyositis also can affect the heart muscle, causing a condition called inflammatory cardiomyopathy. The muscles involved in breathing may be affected, and a few people develop some inflammation of the lungs tissues themselves. Another respiratory complication. Of course, the heart, respiratory, and swallowing problems are the most serious effect of polymyositis and need close monitoring. So, here are the signs and symptoms. Progressive muscle weakness, difficulty swallowing, difficulty speaking, joint and muscle tenderness, fatigue, shortness of breath, and weak throat muscles. What causes polymyositis? In most cases, the cause of an inflammatory myopathy is unclear. For some reason, the body's immune system turns against its own muscles and damages muscle tissue in an autoimmune process. In polymyositis, the inflammatory cells of the immune system directly attack muscle fibers. Normal muscle versus polymyositis. Normal muscles, they are border of muscles bundle. There are normal muscle fibers. Blood vessels with normal muscle fibers are viewed under a microscope. They look like puzzle pieces that fit together neatly. While polymyositis, their inflammatory cells, invasion of fiber by inflammatory cells. In polymyositis, inflammatory cells of the immune system invade previously healthy muscle cells, which become rounded and variable in size. Complications. First, difficulty swallowing. If the muscle in your esophagus are affected, you may have problems swallowing, or dysphagia, which in turn may cause weight loss and malnutrition. Second, aspiration pneumonia. Difficulty swallowing may also cause you to breathe food or liquids, including saliva, into your lungs or aspiration, which can lead to pneumonia. And lastly, breathing problems. If your chest muscles are affected by the disease, you may experience breathing problems such as shortness of breath or, in severe cases, respiratory failure.
Duchenne muscular dystrophy, or DMD, is a progressive and disabling genetic neuromuscular disease which affects approximately 1 in every 3,500 to 5,000 newborn boys. DMD is a universally fatal disease which is characterized by muscle weakness, leading to delayed walking, abnormal gait, and frequent falls, among other developmental delays in the first few years of life. Over time, children gradually lose the ability to walk and typically succumb to respiratory or cardiac failure during their mid-20s. Within muscle, the protein dystrophin performs a critical structural role, anchoring the actin skeleton to the sarcolemma membrane in conjunction with other proteins of the dystroglycan complex. In doing so, dystrophin is thought to help protect the muscle from strain-related damage during muscle contraction. DMD can be caused by a variety of mutations to the dystrophin gene, which is found on the X chromosome. Such mutations can lead to a lack of dystrophin, which results in muscle damage, degeneration, and loss. The dystrophin gene is one of the longest human genes, spanning approximately 2.5 million bases. It is comprised of 79 different protein coding segments, termed exons, which are interspersed amongst introns. To generate the dystrophin protein, the cell must first transcribe the entire length of the dystrophin gene into pre-mRNA. Within the cell, specialized cellular machinery known as the spliceosome binds specific sequences on the pre-mRNA and removes the introns to produce the mature mRNA. The dystrophin mRNA is translated by the ribosome using a reading frame that reads the mRNA 3 nucleotides at a time. Each 3 nucleotide sequence is called a codon, and each codon is translated into 1 amino acid. Amino acids are attached to the growing protein. Incorporation of the correct sequence of amino acids is essential to creating a properly folded functional protein. Most commonly, DMD is caused by frame-shift mutations due to deletions of 1 or more exons from the dystrophin gene. In these cases, the exons following the deletion are misaligned or out of frame, preventing translation of a functional dystrophin protein. Such frame-shift mutations result in production of little or no functional dystrophin protein. Lack of dystrophin leads to a cycle of muscle cell degeneration, inflammation, and fibrosis that is characterized by loss of muscle mass and muscle wasting.
Breath in, hold it, and breath out. Now let's begin. You just used your respiratory system. Now let's discuss the disorders of the respiratory system. So the first disorder of the respiratory system that we are going to discuss here is asthma. So what is asthma? Asthma is a chronic disease involving the airways in the lungs. These airways or bronchial tubes allow air to come in and out of the lungs. If you have asthma, your airways are always inflamed. They become even more swollen and the muscles around the airways can tighten when something triggers your symptoms. This makes it difficult for air to move in and out of the lungs. So what are the causes of asthma? Asthma is a chronic condition in which the airways that carry air to the lungs are inflamed and narrowed. Inflamed airways are very sensitive, and they tend to react to the things in the environment called triggers, such as substances that are inhaled. When the airways react, they swell and narrow even more and also produce extra mucus, all of which make it harder for air to flow to the lungs. The muscles around the airways also tighten, which further restricts airflow. Asthma triggers are different from person to person and can include airborne substances such as pollen, dust mites, mold spores, and the pet dander. Respiratory infections such as the common cold, physical activity or exercise-induced asthma, cold air pollutants and irritants such as smoke. Let's discuss the signs and symptoms of asthma. Early warning signs of asthma include frequent cough, especially at night, losing your breath easily or shortness of breath, feeling tired or weak when exercising, wheezing or coughing after exercise, feeling tired, easily upset, grouchy, or moody. There are 4 levels of asthma based on how severe it is. First, intermittent asthma. You have symptoms less than twice a week and wake up less than 2 nights a month. Second, mild persistent asthma. You have symptoms 2 or more days a week and wake up 3 to 4 nights a month. Third, moderate persistent asthma. You have symptoms at least every day and wake up 1 or more nights a week. Fourth, severe persistent asthma. You have symptoms during the day and wake up every night due to asthma. Let us move to the second disorder of the respiratory system. We have here the lung cancer. So what is a lung cancer? Lung cancer is a disease caused by unchecked growth and spread of some cells from the lungs. Non-small cell lung cancer is one of the 2 major types of lung cancer. The other one is a small lung cancer. Non-small cell lung cancer is the most common type of lung cancer. Small cell lung cancer is the most aggressive type of lung cancer. It grows and spreads more quickly. Let's talk about its risk factors. The most important risk of lung cancer is smoking. Other risk factors include breathing a secondhand smoke, exposure to radon, having family history of lung cancer, HIV infection, exposure to harmful chemicals, and lastly, air pollution. Now let's discuss the symptoms of lung cancer. We have here the chronic cough, chest pain, trouble breathing, coughing up blood, hoarseness, loss of appetite, trouble swallowing, weight loss, tiredness, and facial or neck swelling. Now let's move to the third disorder of respiratory system. We have the pneumonia. Pneumonia is an infection that causes inflammation in the lungs and results in fluid buildup, fever, cough, and difficulty breathing. It's caused by a variety of organisms. First and foremost, what are the causes of pneumonia? Pneumonia has several different causes including viruses, bacteria, fungi, and even parasites in some cases. Common viruses that can cause pneumonia include the flu, RSV, and the common cold. Common bacteria that can cause pneumonia include Streptococcus, Mycoplasma, Haemophilus, and Legionella. So what are the signs and symptoms of pneumonia? Signs and symptoms of pneumonia can vary in severity from person to person. Here are some of the most common examples: productive cough, fever and chills, tachypnea, shortness of breath, chest pain, diaphoresis, fatigue, and cyanosis. Keep in mind that other signs and symptoms for pneumonia exist. These are just the most common examples. Here are the different types of pneumonia. We have community-acquired pneumonia, hospital-acquired pneumonia, ventilator-associated pneumonia, and aspiration pneumonia. Community-acquired pneumonia is when a person gets sick outside of the hospital. Hospital-acquired pneumonia, as the name suggests, is when a patient gets sick during the hospital stay. And ventilator-associated pneumonia is when it's required while the patient is on the mechanical ventilator. And lastly, aspiration pneumonia is acquired when a patient aspirates bacteria into the lungs, usually from food, saliva, or stomach acid.
Digestion is a process in which complex food material is broken down into simpler substances. The digestion of food in humans takes place in the alimentary canal, which is a long tube extending from the mouth to the anus. The different parts of the alimentary canal are vocal cavity, food pipe or esophagus, stomach, small intestine, large intestine, anus. Two glands, namely liver and pancreas, also help in digestion.
Okay, class. So today we'll be learning. Where are Asep and Sarah today? Asep is sick, ma'am. Well, what happened to him? He was saying something is wrong with his digestive system and that he needs to go to the bathroom around 4 to 5 times a day. Sarah is sick too, but she is facing the opposite problem. She is having problems going to the bathroom and feels there is a blocking in her digestive system. Oh, I hope they get well soon. Asep and Sarah are both suffering from the most common disorders of the digestive system. First, let's see what digestive disorders are.
Many problems in the digestive system caused by contaminated food, lack of water, stress, lack of fiber, and the side effect caused by medication can lead to digestive disorders. What did Asep say? He said he had to go to the bathroom more than 3 times a day. His stools were loose, watery, and he had abdominal pain. Asep had diarrhea. Have you ever heard of loose motion? Well, it's another name of diarrhea.
Person passes these stools more than 3 times a day. They are said to have diarrhea. Stools become loose and watery because they move too quickly through the digestive tract. The large intestine is not have enough time to reabsorb water and salt from the waste. The nuclear water is lost from the body. Diarrhea leads to dehydration. This disturbs normal distraction. What causes diarrhea? Bacterial infection, viral infection, parasite, food intolerance, and lastly, side effect of medicine.
At Sarah disorders. She complained that she is unable to relieve herself when she visits the bathroom. Feels her digestive system feels like it's black. Sarah has constipation. Constipation is a condition which a person finds it difficult to pass hard feces out of the
It occurs when waste or stools move too slowly through the digestive tract. More water and salt are absorbed from its stools, caused to become hard and dry. Oh, so it is the opposite of diarrhea. What causes constipation? Insufficient water intake, lack of fiber in diet, not chewing food properly, depression, stress, and anxiety. Crohn's disease is a chronic condition characterized by inflammation in the gastrointestinal or IG tract, which is also known as the digestive tract. Since Crohn's disease is a chronic illness, it is persistent and will be present throughout the patient's life. However, patient and physician can work together to manage the symptoms. Symptoms of Crohn's disease vary depending on location and severity. This means that every patient with Crohn's disease experiences the disease differently. Most patients with Crohn's disease have abdominal pain and diarrhea. Other symptoms related to abdominal tract can include abdominal tenderness, loss of appetite, weight loss, fever, fatigue, rectal bleeding, anal skin tags, and ulcers.
Please have a chair.
Thank you, doctor.
Mrs. Roshan, you don't look well today. Are you having any problem?
Yes, doctor. I am having burning micturition and severe pain in lower abdomen while passing urine.
Okay. Mrs. Raj and I will ask you few more questions. Based on that, I will advise you some investigations which will help in diagnosis.
Today's video is all about bladder cancer. The bladder cancer is a type of cancer arising from the tissues of the urinary bladder. The bladder is a hollow muscular organ in the lower abdomen that collects urine from the kidney through the ureters for storage and eventually remove urine from the body through the urethra. The bladder cancer is a disease in which cells grow abnormally and have the potential to spread to other parts of the body. Bladder cancer is more prevalent in men than in women and usually affects older adults, though it can happen at any age. Different cells in the bladder can be cancerous, and the type of cancer is determined by the type of cell where cancer begins. Transitional cell carcinoma. This type of cancer begins in the transitional cell that lines the inner layer of the bladder. It is the most common cause of bladder cancer. These same cells line the inside of the ureter, kidneys, and the urethras, and tumors can form in those places as well. Thus, an individual with transitional cell cancer of the bladder is at risk for transitional cell cancers of the kidneys or ureter. Squamous cell carcinoma. This type begins when flat squamous cells form in the bladder as a result of chronic bladder inflammation or irritation that has taken place over the months or years. About 1 to 2% of bladder cancer are of this type. Adenocarcinoma. This type begins in the cells that makes up mucus-secreting glands in the bladder. Causes. Doctors know that bladder cancer occurs when something triggers a genetic mutation within the cells in the bladder. This causes normal cells in the bladder to become abnormal and multiply rapidly and continue to accumulate, forming a tumor or mass. A certain risk factor that may increase the risk of bladder cancer are smoking tobacco and cigarettes, occupational exposure to certain chemicals, increasing age, being male, having a family history of bladder cancer, chronic bladder inflammation, previous cancer treatment. Symptoms. Symptoms may include pelvic pain, painful urination, blood in the urine, pain in the lower back, frequent urination, urgent urination.
A kidney stone can be as small as the head of a pin, almost invisible to the naked eye. But as every stone former knows, the pain resulting from this tiny crystal structure can be enormous. Inside kidney stone disease. Kidney stones, or renal calculi, are aggregates of crystals enclosed in a matrix that develop within the kidneys. They're classified according to the specific types of crystals they contain and fall into 5 major categories: calcium oxalate, calcium phosphate, struvite, uric acid, and cysteine. The most common is calcium oxalate. How is a stone formed? The first step is nucleation. Ions such as calcium and oxalate that have been filtered into the urine by the kidney spontaneously join together to form a solid crystal nidus. This is called nucleation. There are 2 kinds of nucleation. In homogeneous nucleation, crystals form around a nucleus with the same composition. Crystals of a different composition can also form around the nucleus. Organic materials, such as cell debris, may be deposited between the crystals as a matrix. This is heterogeneous nucleation. The tiny crystal formations travel down the nephron and are usually deposited at the renal papilla, where they undergo the next major phase, growth. Crystals that have already formed then begin to stick together, forming large aggregates. As we can see, crystals can aggregate very quickly. New stones are retained in the kidney, where they can continue to grow for an unspecified length of time until, for reasons that are not well understood, they are displaced and travel through the kidney into the ureter. If a stone continues to grow until it reaches a critical size, which can be as small as 4 to 5 millimeters in diameter, it may be too large to pass easily through the ureter. The edges of the stone may become wedged inside the ureter at the ureteral-pelvic junction, where the ureter crosses over the iliac artery, or at the ureteral vesicle junction. The result? Pain and obstruction, until the stone slowly passes into the bladder and eventually passes out of the body in the urine stream.
Symptoms: pain in the side of your tummy, abdomen, or groin. Men may have pain in their testicles, feeling sweaty, feeling sick or vomiting, a high temperature, blood in your urine, urine infection.
Cystitis, also known as the inferior urinary tract infection, is the inflammation of the bladder. Cystitis is more common in women because women's urethra is shorter than men's urethra and it is closer to the anus. The urethra is the last tubular structure of the urinary tract that conducts the urine from the bladder to the outside of the body. Women's urethra is about 4 centimeters long. Men's urethra is about 15 to 25 centimeters long. The most common cause of acute cystitis is bacterial infection, in many cases caused by a bacterium called Escherichia coli. Normally, the urinary tract is sterile. Sometimes bacteria from the skin can get into the urethra and migrate back up the urinary tract, causing urinary tract infections. The most important contributing factors are constipation, sex, low fluid intake, cold. Clinical symptoms include pollakiuria, which is an abnormally frequent urination, dysuria, which is pain or a burning sensation during urination, pain in the inferior abdominal region, cloudy urine, hematuria, meaning blood in urine, but this symptom is rare in cystitis.
What is cardiovascular disease or CVD? It is a general term for conditions affecting the heart or blood vessels. It's usually associated with a buildup of fatty deposits inside arteries or atherosclerosis, and increased risk of blood clots. It can also be associated with damage to arteries in organs such as the brain, heart, kidneys, and eyes. In many cases, cardiovascular disease is caused by the chronic inflammatory conditions, atherosclerosis, due to unhealthy eating habits and the lack of exercise, deposits of fat, cholesterol, and other substances present in the blood buildup over many years inside the arteries. White blood cells are attracted, triggering an inflammatory process. Over time, the resulting plaques cause the artery to narrow and harden, obstructing blood flows. However, not all patients appear to have stable plaques, which build up and eventually limits blood flow. Some patients suffer from unstable plaques, which pose an additional threat. Unstable plaques is prone in sudden rupture, which causes local blood clotting and may even completely block the vessels. If this happens in the coronary artery, the heart's maybe can stop the oxygen, resulting a death of cardiac muscle cells and heart attack. Physical exercise and healthy diet prevent all forms of CVD, while drinking and smoking are risk factors. As atherosclerosis progresses, patients are increasingly exhausted after physical exertion, while severe cases cannot participate in everyday activities, like walking uphill. Currently, clinicians do not fully understand why CVD progresses faster in some patients than in others. We know from studying tissues that unstable plaques have a thin fibrous cap over large lipid core, while a stable plaque has thick fibrous caps that prevents premature rupture. Modern therapeutics options are available for patients with CVD to reduce the risk of plaque progression or rupture. But how we can identify the patient who would benefit from such as treatment? Disease, arteries, and plaques release molecules into the bloodstream.